Today, I want to talk about why we can consider relaunch at this time. First, the outbreaks I mentioned represent pockets of infection that we must deal with. However, much of the province has been successful at flattening the curve. Hospitalizations and ICU admissions are down, recovered case numbers are up, and I am encouraged to see fewer daily new cases than even 1 week ago. We continue to see cases of community transmission, and people have asked me how we can reopen our province when the virus is still spreading in our communities. We put our first restrictions in place after identifying 1 case of community transmission. That was in early March. I know it feels like a long time ago, and that is exactly the point. Much has changed in our society since then, and it will remain different for a long time still. Our societal norms around hygiene and physical distancing are different today. We are in the habit of washing our hands thoroughly and often. Whenever we unpack our groceries, handle goods delivered to our home, or come home from any location, we wash our hands for at least 20 seconds in warm, soapy water. We also maintain physical distance. We are well aware what 2 meters looks like and are accustomed to keeping this distance between one another. These will remain habits and, in fact, will become even more important as we leave our homes more often. We have put in place protective measures for those who are most vulnerable to severe outcomes by enhancing protections in continuing care facilities across the province to keep them safe from this virus. We have also enhanced our lab capacity and our ability to trace contacts and contain outbreaks. With this capacity, even though we will continue to see some cases of COVID-19 in our communities, we have the testing capacity and contact tracing ability to quickly identify new cases and prevent further spread much more promptly than we could at the start of this pandemic. With this expanded testing capacity, we also have the ability to do extra sampling in certain situations where we need more information about the spread of the virus. This week, we will be offering extra testing in Calgary as we are still seeing higher case numbers there than the rest of the province. While we don't know how much asymptomatic spread may contribute to transmission in a population, we know it is possible. Therefore, to get a broader snapshot of infections in Calgary, we will be making testing available for 1 week, starting today, to asymptomatic Calgary Zone residents who work outside the home. We can only test up to 1,000 people per day in order to make sure we leave room to test those who are sick. But I encourage anyone in the Calgary Zone who is interested to participate to go online and register for a test. It is important to remember that testing people who aren't sick just gives a point-in-time picture of whether they have the virus at a particular moment in time. It is possible, if someone has had an exposure, that they could test negative but go on to get sick later. However, offering testing to this group of people will give us more information about COVID-19 in Calgary at this point in time.
Today, I'm here to announce an additional resource to help businesses prepare for reopening. My department has launched our BizConnect website, which can be found at alberta.ca/BizConnect. That's biz with a Z. This new business-specific webpage will help businesses learn more about the public health measures they need to have in place before reopening. These measures will help keep their staff and customers safer while operating during a pandemic. The website's sector-specific information gives businesses an easy-to-follow roadmap for reopening. Information will continually be updated to support the various sectors as they relaunch. Today, you will find information for the following sectors: hair salons and barbershops, daycares, day camps, restaurants, retail, museums and art galleries, outdoor shooting ranges, and more. This website will also provide businesses with a platform to ask questions. The BizConnect website also contains an up-to-date Common Asked Questions section.